If your penis is curved to one side, either to the left or to the right, this video is for you. That disease that is called Peyronie's disease. A lot of requests, a lot of comments at the comment section. A lot of people will ask, how can we treat Peyronie's disease? And some people even ask, what is Peyronie's disease? Whereas we had one video, we took time to explain what it is, explaining that some people have a penis that is curved, either to the left or to the right, or curved downward, or some even curved upward. You have a curve or a curved penis. How can we treat it? That is called Peyronie's disease. My name is Dr. David Ayim, PhD in public health, and I am your reproductive health expert. I will keep doing the research and teaching the world at large through YouTube and Facebook. You know, you can't understand who you are helping somewhere, somehow. But God has provided such medium that we can reach out to many free of charge. You may only need some data, dumb data on your phone to be able to follow. And we feel comfortable with it. Now, the lesson of today, we'll go straight to it. How to treat Peyronie's disease. And it is that disease whereby the penis is curved. A lot of people that have a curved penis are not happy about it, and they wish to know how to cause their penis to be firm. Now, there are 3 types of drugs that could be used. 1, NSAIDs. NSAIDs, if you have studied pharmacology, you know that capital N, capital S, okay, capital A, capital I, capital D, and capital S, NSAIDs. They are non-steroidal anti-inflammatory drugs. That's what it means, NSAIDs. A typical example here that is good is ibuprofen. Okay, we don't know what you could have as anti-inflammatory drugs. There are several types in your area. You can do it in it, provided it is it's a non-steroidal anti-inflammatory drug, because this is going to reduce pain, because there are certain exercises we need to involve that for you to avoid pain, you take this drug and then you can engage on an exercise which will bring. Apart from using NSAIDs, you can actually, take pills. There are some tablets we actually refer to some as pentoxifylline. Okay, this is a combination of vitamin C and colchicine. They are used to reduce scarring, so that some scar tissue doesn't form at the curve. When it starts forming scar tissue, it can't go. It will not be good for you. So it keeps the penis tissue soft and prevent scarring. Yet there are pills that you take, like tablets. Now you also have some that you apply, like collagenase, interferon, verapamil. All of them are still used to reduce scarring. Now, what are the practices, the exercises, the kind of actions to take to try to solve this curve problem? 1, penile traction. Penile traction means you to straighten penis. How to straighten penis? It warrants you to create some time and sit down between 10 minutes to 15 minutes and hold the penis, and you are doing a kind of stretching, massage, gentle massage while straightening it. Of course, you have to make your hands soft. You can use lubricants, very soft lubricants. And you hold your penis and you do what? You stretch and support. You stretch and support. Even where you think that is causing you pain, now you have to go into the drugs we have already introduced. Okay, so they will reduce pain, and then when you stretch, trying to stretch, there may be some degree of tearing beneath the skin tissue that may be causing some blood vessels to tear. Okay, and when some blood vessels crack, blood leaks in from out of it beneath the skin, they form something like stretch marks. Okay, now reason for which we have taught you the various, I've already talked about the various drugs that you can use to prevent scarring, so it shouldn't form scars or scar tissue. I hope the explanation is good. So you sit on it and take them stretching your penis, stretching. It's a stretching exercise. And when you sit down, give yourself like 10 minutes, between 10 to 15 minutes, and continue to stretch. Now, number 2, you can apply heat compress or hot compresses. Okay, somebody could use simple sponge. Okay, and you soak it in warm water, or water that is hot, not too hot to burn your body. Mean water that could, when you make it, is really warm and almost hot, so that you hold the penis. The warm compress, first of all, promotes blood circulation, and then you use it to help to straighten the penis. Take it as an exercise that you do 2 times in a day. You sit down like 10 minutes on it before you go to bed. Take your time and do the stretching, like 10 minutes, leave it. When you come back in the evening, before you sleep, you take your time and sit down and do that. Sometimes when you are taking your bath, even when you touch, soft soaps that you put, not harsh things, when it foams well and slippery in your hands, you can actually hold your penis and straighten. It looks as if you are doing masturbation, but you are not masturbating. You are straightening a curved penis, and as you are straightening, you'll be surprised that if you start doing this exercise and regularly, within 21 days and more, you will observe the great change. And before you go to 2 months, 3 months, you may not have a problem again with that penis. Now, apply topical verapamil. Okay, if you have it, you can go to the market and verify verapamil, so you can apply on the penis, use it and stretch. Now you can apply magnesium on that penis and use it to stretch. And you will see that in fact, as days are passing, you are correcting your problem yourself. Then certain exercises. Do exercises that improve blood circulation in your body, encourages blood circulation, and the exercises that can easily cause penis to erect. The more active the penis, the more you easily correct Peyronie's disease. Some of such exercise is sexual intercourse. How regular do you have sex? Now, your loving female partner can understand this with you, and sometimes you comfortably lie down and it helps you to do stretching exercise. Yes, I know before you touch that, pop, you have erection. It's easier, but it should be gentle so that it doesn't cause certain degree of tearing that could cause scar tissue. However, there are these substances that you use them to prevent scarring. Now, fight weight loss. Try to reduce weight loss, because if you are obese, if you are getting too fat, it will not really be easy, because such conditions, first of all, reduce your libido, your erectile capacity, and you cannot easily have erection. If you suffer from sexual weakness, just such exercises will gradually put it up, because all such exercises will increase blood flow to your penis tissue and gradually straighten tissue. Remember, human tissue is flexible. That is why you can break even your bone, and we can immobilize it and put it back together, and after some time it heals. That is why some part of the body can completely bend, and certain exercises, consistently, finally straighten it, because new tissues grow over time, and they are growing and following the new direction that is tilted. So it is a consistent exercise you are going to put in place. Finally, please avoid alcohol, avoid smoking while you are treating Peyronie's disease, and it will be easy for you. Thank you. Thank you for listening. Let's not make our video too long. you can please subscribe if you have not yet subscribed. Like and share. Make your comments. You can write to us even on WhatsApp. My contact 674-6054-69. If you're out of Cameroon, always start with +237. Thank you. I have to remind you about the training institution, Higher Institute of Health and Biomedical Sciences, FOCONS Higher Institute of Health and Biomedical Sciences, Karinko, Bamenda, Cameroon. It is a step-by-step junction. I put my hand only in the things that can train quality health personnel, that you can continue with first degree, master's to PhD, can do any nursing, midwifery, laboratory technology at any level, pharmacy attendants, whatever health personnel. Send your candidates to that school. I will be there with them too. Thank you. Have a nice time.